Let's talk about digestion. When you use the word digestion, most people think of either heartburn symptoms, indigestion. They might think about how well someone's pooping. And these are all things that fall under the umbrella of the word digestion. So in my office, one of the main things we focus on here, and I will ask everyone every visit, how are you pooping? How's your digestion? So we care about this for many reasons, but chief among them is that digestion is really the most important thing when it comes to underlying fundamental health. So if you have poor digestion, so that can mean if you aren't pooping enough, that would be a problem. If you're pooping too much, that's also a problem. If your stools are loose or have undigested food in them, that's a problem. And obviously, if you have heartburn or acid reflux, that can cause all kinds of other symptoms as well. So we always talk about this with every patient, every visit, because if your digestive system is stressed and isn't working efficiently, then you're not going to get the nutrients that you need, even if you're taking really excellent supplements. So obviously around here, we recommend supplements, but we want them to actually work. So when you put food in your mouth or supplements in your mouth, those nutrients start to be digested immediately. So it starts with your saliva, so the parotid glands and some other salivary glands that produce saliva. The food starts to get broken down immediately, and of course chewing helps. But if it's a liquid, either way, the saliva starts on the process of breaking the food into smaller pieces. It travels down through the esophagus into the stomach. There's a sphincter at the top of the stomach, or a muscle that's supposed to keep the contents of the food only going in that direction, which of course we see a lot of people who have a problem with the food going in the opposite direction. So that could be corrected as well. And then the food in your stomach gets mixed with acid and churned or stirred up and squeezed until it's really more of a liquid by the time it goes into your small intestine, then into your large intestine, and then eventually, hopefully, out through the sewer. And during that whole time, from mouth to sewer, we are worried about whether or not the food is being broken down into small enough pieces and eventually broken down into the actual tiny nutrients like vitamins and minerals that your body needs. And then how well the little powerhouses of bacteria and other microbes in your gut that are actually working to absorb those nutrients and pull them into the bloodstream and then distribute them through the body for use. So if your gut lining is irritated, if your stomach is irritated, if your saliva isn't good quality, all those things can matter in your overall health picture because we need those things working optimally. So some of my very favorite supplements that we recommend to people who are having dysfunction in the digestive system, we'll start with if something's going wrong in the stomach or the upper small intestine. So if your stomach is irritated, if you have an ulcer or the beginnings of an ulcer, most people don't have ulcers. Most people just have inflammation that if left untreated could change into an ulcer. And so you eat food, even water, and you feel a burning or a discomfort, nausea, some sort of indigestion or upset stomach, that would indicate that there's an inflammation in the stomach itself. So we use a product called Gastrex. This isn't it. Hang on, I'll find it. Gastrex. So Gastrex from Standard Process, you can think of it sort of like you would think of Pepto-Bismol or even better, some like Alka-Seltzer. So it can be swallowed as the capsule, or it can actually be opened, put into warm water, the contents, and then you drink it so it coats and soothes all the way from your throat down to your tummy. We usually only do that if it's a very acute or very painful situation. But mostly we just have people swallow the capsule. And once the capsule opens in your stomach, it has very soothing ingredients that will coat and soothe the inner lining of the stomach and the upper part of the small intestine. This is great at helping to just coat and soothe and put out that fire so that you have less irritation and inflammation. It does have a positive effect on bowel movements. I have used it for irritation lower in the bowel, and I've seen that it can encourage normal, healthy bowel movements as well. So that's Gastrex. The second one we can talk about is Zypan. So Zypan helps with stomach acid. It is stomach acid. It's hydrochloric acid. So, and a couple other things. But this actually makes your stomach work better. So it's more efficient if you have enough acid to break down, especially proteins, in the stomach. So one of the reasons why people get acid indigestions, one of the main reasons actually, is not enough stomach acid or not good quality stomach acid. So if you're taking antacids, Prilosec, Tums to try to reduce the acid, that's actually the wrong action for most people. Most people need more acid so they do a better and efficient job of breaking down their food. That way the food actually gets digested properly. Otherwise it sits in your stomach and it ferments, and that's why you get the acid reflux and the heartburn coming up into your esophagus. So most people need Zypan, especially with high protein meals. If you're having a steak, if you're having roast, if you're having a chicken dinner, you definitely need Zypan in your life. Usually 1 to 2 tablets per meal. The other thing that we need is we need the carbohydrates in our body to be broken down. So once we eat anything that has starch in it, and that includes vegetables and fruit, you need to break down the carbohydrates into smaller pieces so the body can utilize those and additionally get the nutrients out of that system. So Enzicor, this is a plant-based enzyme product. It's great for breaking down foods, especially carbohydrates. So we would use this for anyone who feels after they eat bloated, distended, gassy, if you have trouble regulating your blood sugar after you eat, if you have trouble tolerating sugar. Now, we don't want you to eat a lot of sugar, okay? We don't want you to be able to, quote, tolerate sugar, but you shouldn't eat something that's high in carbohydrates and just automatically go, super high blood sugar, then super low blood sugar. We don't want that. So this supports your pancreas, which is also part of the digestive system, and the pancreas helps you digest carbohydrates and balance blood sugar. It also supports small and large intestine and the food breaking down and the carbohydrates breaking down there. So less distension and discomfort. Again, 1 to 2 capsules per meal is a typical dosage. So all of those things matter a lot. You have to have the right nutrients and the right support so that the organs are working properly. Of course, you have to try and eat the right foods, not too many sugars or processed foods. I don't recommend drinking a lot of fluid with your meal. You're better off leaving the fluid for after the meal or a time like 20, 30 minutes before a meal, because you don't want to dilute the stomach acid with water or other beverages right before you put a bunch of food in there. So it's kind of opposite of what a lot of people have learned. Some people say, drink a huge glass of water so you don't eat as much food. I don't really agree with that idea, because you should eat slowly, chew your food thoroughly, and ideally be in a rested state when you're eating. So ideally not standing at the kitchen counter or running to your next event or your next meeting, not in the car, but really actually sitting and chewing and taking your time. If you do that, you won't overeat, because your body will actually tell you it's full in time for you to stop eating. If you eat everything in 3 minutes, then your body never gets a chance to signal, hey, that's too much food for me. So if you eat slowly, chew thoroughly, and are in a rested state, then you don't have to worry about overeating. So therefore, you don't need to drink a bunch of water beforehand to prevent overeating. So these are tips I hope can help you improve your digestion. Obviously, around here, we are always happy to help with your particular case, your particular issues. If you have food sensitivities or other more advanced or problematic digestive issues, we certainly have great results helping people with that. So please contact us if you need any help, and otherwise I'll see you next time.